Hi.
Hello.
Hi, my name's Jake. I'll be taking care of you today. What's your
Hi,
name?
my name's Adam.
Hi, Adam. Nice to meet you.
Nice to meet you.
What brings you in today?
Gosh, I just have not been feeling good.
Okay.
Ever since I went to this trip, I just have been feeling really crappy.
Okay.
I feel like I can't catch my breath sometimes.
Sure. Okay, how long's that been going on for?
Well, let's see. I flew to a family gathering, family reunion like 2 weeks ago.
Okay.
So it seems like ever since then, I've just been kind of feeling gunky.
Okay.
It's never went away.
You said it started how long ago?
About 2 weeks ago.
2 weeks ago? Okay. When you said you've been feeling, not very well, are you having fever, chills, any sweats, aches, pains?
Yeah, I just overall haven't been feeling good, and then I haven't taken my temperature, but I feel like I've had that, like when
Sure.
you feel like you have a temperature, kind of cold chills.
Sure.
What'd you say, nausea? I feel like I've had that a little bit, where I just haven't
Been a little nauseous? Okay.
Yeah.
All right. And then with the shortness of breath, is that all the time? Is it worsened when you're up doing things
It's
at
definitely
night?
Oh yeah,
Sorry,
it's definitely worse when I'm moving around or laying down.
okay.
And like I said, I don't know, like at this gathering, I know a couple people had said they were maybe sick, so I thought maybe I had a cold, but it just seems like it's never went away, and it's
Okay.
kind of gotten worse.
All right. And then have you had any chest pain with this?
Oh yeah, I've definitely had a cough.
Okay.
Every time I'm moving around, I cough and it hurts on my chest.
It does hurt your chest. Okay.
Yeah.
Is anything coming up with this cough that you're having?
No, it feels like I have gunk, but nothing's
Just been pretty
coming out.
dry.
Yeah.
Okay, no blood, mucus, phlegm,
No.
nothing like that. No crazy colors coming out of your chest
No.
here. Okay. And you said you're a little bit nauseous. Have you had any abdominal pain with that?
No, I
No?
would say no.
Any diarrhea?
Nope, I haven't been eating as much as normal, but otherwise I feel like my bowels are
Sure. Okay.
normal.
Do you have any medical problems as far as in your heart or lungs at all?
No, I was told I don't have any,
Okay.
I'm not diagnosed with anything.
No diabetes, hypertension,
No.
asthma. Okay.
No.
Any past history of surgeries?
I did have a bunionectomy in 2018,
Sure.
but that's it, really.
What about your family? Any history of COPD or lung cancer? Any problems with their heart, lungs, or otherwise?
Let's see. Well, my dad, he was diagnosed with colon cancer and passed away when he was 60.
Okay.
And then my mother had hyperthyroidism,
Okay.
and that's the only thing I know they've had.
Okay. Wonderful. And then just getting into some social stuff. Do you drink at all?
Very rarely, maybe like once a month or every even 2 months.
Okay. Sounds good. And then any drug use?
No, I used marijuana when I was younger, but I haven't used that in a long time.
Okay. Nothing recently.
Not for years and years. No.
Okay. And then any tobacco use?
Yeah, I smoke about a pack a day, probably.
Okay. And how long have you been doing that for?
Since I was 16.
Since about 16. Okay. Well, there's always options too if you feel like you need help or are in the want to kind of quit smoking or maybe just like take it easy on smoking. We can hook you up with a tobacco cessation expert, and that is an option we have. So, but it's all about when you're ready to do it. We can definitely explore that option.
Oh, that's cool. Yeah.
Any allergies for you?
Sulfa-based drugs, I guess.
Okay.
I was told that when I was really young. I'm not sure.
Okay. Do you know what happens when you take sulfa-based drugs?
No.
It was kind of a while ago.
Yeah, it was when I was like 2.
Sure.
My parents just told me I have that.
And kind of just stuck with you from the rest of the time there.
Yeah.
Huh? Okay, wonderful. Well, that's all the questions I have for you at the moment. Before we move into the physical assessment, are there any questions you have for me?
No, I think that's it.
Okay. So what I'll have you do is just sit up nice and straight, but I'll have you take your shirt off for me so I
Okay.
can take a listen to your heart and lungs here.
Sure.
All right. So I'm just going to take a nice big deep look here. Everything looks good. You got some unilateral hair growth here. Has that been there for a while?
Yeah, ever since I hit puberty, it's just a birthmark, I've told.
Just normal for you?
Yeah.
Okay. All right, everything looks even. No trauma to the chest that you've had recently. No hits, falls.
No.
Nothing like that. Okay. And then you just relax your arms out to the side and then stand up for me quick.
Sure.
Okay. I want you to take in a nice deep breath here. Good. Everything's moving normally. Another deep breath here. Sorry. Does your cough get worse with deep breaths?
Yeah.
Okay.
Yep.
Sounds good. You can go ahead and have a seat here. How do you feel standing up? Any dizziness at all?
Maybe a little lightheadedness.
Okay.
Yeah, and I feel like I'm breathing heavier, even
Sure,
just a
when you're
little
doing
movement.
activity and stuff.
Yeah.
Okay. Sounds so. Get you figured figure it out here. I'm going to take a listen. Start with your heart, and then we'll move to your lungs, okay? So for right now, you can just breathe in and out normally.
Okay.
Just listening to all the different areas of your heart here.
Oh, okay.
Everything sounds good. I'm going to listen to your lungs here now. Taking those nice deep breaths as best you can. Sorry. Is it painful to take breaths, or do you just feel that cough come on?
A little bit in the middle of the chest, but not super bad.
Good. Okay, I'm going to move to your back now. And just the same thing, nice deep breath as best you can. This is just listening to all the different lobes of your lung here, okay? Good. Almost done. Okay, you're a little, sound a little bit diminished on the right side as opposed to like the other side sound very full and expanding properly. So I'm gonna just do one more thing, okay? I'm gonna come over to your side here.
Yeah.
And I'm just gonna kind of do some tapping. This might seem a little bit weird, but you can breathe normal. Okay.
It's weird how it sounds different sometimes.
Yeah. And on that right side, I'm just noticing a little bit more dullness than on the left side. And that can kind of get into what we're talking about here. So with your symptoms, your shortness of breath, your fevers, your chills, a little bit more diminished on that right lower side, a little bit of dullness with percussion. My ears are kind of ringing towards pneumonia.
Okay.
Whether this is caused by bacteria, by a virus, is a little bit unclear right now. So what we can do is we'll get a chest x-ray for you.
Okay.
Start there, we'll do some labs, we'll check your blood counts, we'll check your electrolytes, we'll check some markers that can kind of indicate the infection that's kind of going on or any kind of inflammatory markers.
Okay.
And then I would like to get an EKG just because you complained a little bit about some chest pain, so I just want to make sure we're not missing any emergencies there.
Okay.
But we'll start with the chest x-ray in the blood and then move on from there. I also would like to get a viral swab. It's a Q-tip, kind of goes in the nose, a little uncomfortable on both sides, but then we can see if you have any COVID, influenzas A or B, and RSV. So it's kind of the big ones that we look for, and then we can move on from there. And then the chest x-ray will kind of give us a little bit more indication as far as what's going on with your lungs there, okay?
Okay.
I know that you said with the nausea you weren't experiencing any abdominal pain.
No.
Not really? Okay. If it's okay with you, I kind of missed it, but can I have you just lay down? I want to take a quick peek at your stomach.
Sure, yeah. Yeah, better be safe than sorry.
Sure. Ugh. All right. Everything looks good. And you said no diarrhea?
No.
Okay. All right. I'm going to just kind of feel here. I'm going to listen to you a little bit. And if I cause any pain for you, just let me know, okay? Everything's sounding good. All right, so just listen to the different quadrants of your bowel. Everything's sounding okay. I'm gonna go ahead and palpate a little bit.
Sure.
Sorry, and let me know if I cause you any discomfort at all. No. Okay. Okay. Sorry about that. I just wanted to check out your stomach here.
I appreciate it.
So let's start off with that chest X-ray. Get a good look at the heart and the lungs. Then we'll move on to the labs and get that viral swab and kind of move on from there. Your vitals showed that your oxygen's a little lower than I'd like for a normal person of your age. The number I think was 91 that they got. However, you do have a history of smoking, but it's something I just kind of want to keep an eye on, and we can kind of correlate that in with everything else that we get back once our assessment is done, okay?
Okay.
Do you have any questions for me right now?
No, I think that's it.
Wonderful. Well, let's get started and try to get you on the road to feeling better, okay?
Awesome.
Right.
Appreciate your time.
We'll be with you shortly, okay?
Thank you.
Yep.